Hello, I'm JW, and I'm here to talk to you about some amazing new breakthroughs in the field of dentistry. If you're suffering from problems associated with missing a single tooth, multiple teeth, or the hassles that come with loose and ill-fitting dentures, then we have the solution for you. Mini dental implants are an affordable, virtually pain-free, and easy on the patient solution to these problems. In a minute, I'll be talking with Dr. Dean Wright at Cambridge Family Dentistry, who will tell you about these incredible dental implants. Dr. Wright received his Doctor of Dental Surgery degree in 1976. For over 32 years, he and other dentists he is associated with have developed and evolved into what is now Cambridge Family Dentistry, located in Wichita, Kansas. With 6 doctors, 20 treatment rooms, and all of the necessary supporting staff, Cambridge Family Dentistry has become one of the largest implant and general dentistry clinics in the country. Cambridge can handle same-day emergencies, quick appointment times, and personalized one-on-one care. Because of the highly trained doctors and staff and the modern office and implant center, Cambridge is able to offer its patients the latest advances in the dental field. One of these extraordinary advances is the mini dental implant. These small implants can replace single or multiple missing teeth and firmly attach partials and dentures. They are truly one of the greatest advances ever in dentistry. When we come back, we'll meet Dr. Wright at Cambridge Family Dentistry, who not only teaches other dentists about implant dentistry, but has also personally placed over 5,000 implants for his own patients. He will tell us how mini dental implants can have an astonishing impact on your life. We'll be right back.
I learned of Dr. Wright through a coworker. He was having some work done and was just very complimentary of how it was handled, and I just thought I'd just make the appointment, do the consultation, and I was convinced. I came in about 7. I was out of here by probably 10:30. We were finished by 10, and then I came back that afternoon at 4 o'clock, and I had a whole new set of teeth. I was good. The pain and the discomfort and the loose teeth are gone, and she's been married to me for over 40 years, and she says, "Your teeth have never looked that good. You should have done it 40 years ago."
Welcome back. We hope we've inspired you to call the toll-free number to receive your complimentary examination. We're confident that you'll be glad that you made that call. Now I'd like to welcome Dr. Dean Wright of Cambridge Family Dentistry. Thank you for joining us, Dr. Wright.
Well, thank you for having me.
With over 32 years' experience, you have performed thousands of dental procedures, from fillings to oral surgery. And your clinic, the Cambridge Family Dentistry, they've placed over 5,000 implants. Why do the mini dental implants stand out to you so much, and why is it so important that we're here today to tell everyone about them?
Well, we are unique in the fact that with the mini dental implants, we can place the appliance in one day. In other words, the patient can come in, they can have the implants placed and a denture or partial or even crowns and bridges attached in their mouth, and then leave and eat a meal that afternoon.
Wow.
So this is pretty unique. There's very few clinics in the country that can do that. Also, the patient satisfaction is just so extreme that they are overjoyed and so happy when they had this procedure done that they will literally thank you so much. And I've even seen them cry and give me a hug.
Wow, that's wonderful.
So from a doctor's standpoint, that is just very satisfying.
Absolutely. Well, a new patient, what would their first visit be like?
When the patient comes in, we would like to greet them as not only a patient but as a friend. Coming to the dental office can be an emotional experience, and so we want them to be at ease with us and any procedures we're going to perform. So we'll take personal information, a very detailed health history, as well as any necessary x-rays and maybe even a 3D CAT scan to be able to look at all the dimensions of the bone that they have. After that, we'll have a consultation in privacy with the doctor that will explain what could be done and any necessary fees.
Well, after the patient decides to have the procedure, what's the second appointment? What does that involve, and where does that take place?
It'll take place at our office. The patient might be coming in to have new appliances made, like dentures or partials or crowns and bridges. But if they have an appliance that's satisfactory, like a very good denture, but it's just loose and needs to be attached, then we'll put the implants in that day. And we'll also go ahead and rebuild the underside of their denture and put any necessary attachments, and they'll pick that up later in the day, place it in firmly, and go out and eat a meal.
Wow. What about follow-up appointments?
We usually want to see the patient within 2 to 5 days, but we might have them come back in 1 day. But for sure at a week, 1 month, and then a year. And we make those appointments complimentary. That's part of any fees we charge. And we're happy to take care of that. And if they need to come in more, that's covered also.
That's great. How long does the procedure take?
Normally about an hour and a half. And we would like to start that early of a morning if we have any lab work involved. But if a patient's going to have more done in the way of like extractions and a lot of denture work, or maybe do the upper and the lower all at the same time, we may spend 3 to 4 hours. So sometimes we start at 7 o'clock in the morning, and a lot of times 8 o'clock is sufficient.
Is it uncomfortable?
No, it really isn't. During the procedure, the patient will be completely anesthetized, most of the time with local anesthetic, or if they prefer, they could be put to sleep. And after that, we will give them any necessary medication for the uncomfortableness, and also for an anti-inflammatory that might help them to feel better afterwards.
Okay, so will I have to miss work, or how long is my recovery time?
A lot of times, a Friday appointment's pretty good because you'll be in great shape by Monday to go back to work. But if a person does it earlier in the week, a day or two off work is about all that's necessary.
Okay. So what are the benefits of having these dental implants?
Oh my, there's so many, but you know, the ones that come to mind are, of course, you'll be able to chew better. If you look at a patient that wears a lower denture, it's probably one of the worst things that they've ever had done in their life. And it's very uncomfortable. It has sores, and it bounces and moves around. And so just by attaching that and making it firm in their mouth, they're going to be able to eat about 90% as good as they had real teeth, as opposed to only 30% if they had full dentures with no implants. Also increased confidence. A patient would smile more. Absolutely. They're going to feel like they have their own teeth. That's what patients tell me. And of course, they're going to have less pain because the implant's going to support the denture, and the denture won't rub on the gum tissue anymore. You can talk and sing better if that's what you like to do. And in fact, the first mini dental implant patient about 20 years ago was a vocal music teacher with the Juilliard School of Music. And she literally had the lower denture fly out of her mouth a couple of times in front of her students, and she was so embarrassed. She went to her doctor or her dentist, and the dentist felt compelled to try to find new technology. So the dentist did some research with orthopedic appliances and stainless steel type screws, and from this he was able to figure out a way of putting small screws into bone that might attach and hold down her denture. So he placed this denture in the patient's mouth, and it worked for I believe around 20 years before she was deceased.
Wow.
So that's how this all started.
Yes.
Other benefits that might come about would be it preserves bone. A lot of denture patients, the bone just keeps shrinking with the implants. We find that the bone is preserved, and in some cases even grows more. On an upper plate, we can cut away the palate of the denture, and we'll show you here in a moment what that looks like. And then the patient can taste the food better and have no gagging.
Wow.
So that's a nice benefit.
So many benefits.
You want to hear some more?
Yes,
All
absolutely.
Right. How about not using any adhesives? I had a lady one time come in. She had a tube of adhesives that was so big she got it off the internet, and she literally said that she placed it 5 times during the day and planned her whole day around the adhesives.
Oh.
That's tragic, isn't it?
Yes.
So we had a celebration after we performed her mini implants, and we took that tube and we threw it away.
Excellent.
There's also, of course, no more decay because the implant is strong and does not deteriorate. How about a fresher mouth and breath, too? Because without teeth that might be causing odor,
yes,
you could easily have a fresher mouth. So many, many benefits, and I could go on all day, but...
you mentioned in your story that the one patient, her implants lasted 20 years. Is that a typical length of time an implant will last?
Well, implants have been around in dentistry for a good 20, 30 years, but the mini implants have only come into vogue maybe in the last decade. Okay. We started about 8 years ago, and we saw the benefits and the new technology, and we felt like this was going to be the way dentistry would go. And so we did more research and probably placed more of these than any other clinic in the country. We feel like that they could go indefinitely because they tend to get stronger with time because the bone actually integrates and will grow into the implant, and they get stronger with time.
Interesting. And what's the cost of this procedure?
There's different types of implants. With the mini dental implants, we only have to charge about 1/4 as much as some larger implants. So that's a very good cost savings to the patient. Also, about a year ago, we could see the economic crisis that was coming in our society, and we felt like, we should lower fees and not raise them. So we actually lowered our fees to help patients benefit from the technology that we can perform. A good story is the fact that I had a patient one time come through my clinic, and she was from Florida, but she had the mini dental implants placed down there, not at our clinic. And this lady told me a price that she had paid for it, and it was about 3 times what we would have charged. And I kind of kiddingly told her, I said, well, you paid about 3 times more than we would have charged you for that procedure. And she was just as cute as could be and elderly. She leaned over and looked at me. She said, I would gladly have paid twice as much for the benefit it's given me.
Wow.
Well, right then and there, I knew just how strong the mini implant can have as a life-changing experience, because if she felt that strong about it, she'd already overpaid, maybe, in my opinion, in the first place, but she was willing to even pay more. I knew that was a very strong testimony.
Yeah. Do you offer any type of payment plans?
Yes, we have a number of payment plans, and they're customized to the patient. So depending on what the patient's having done and the cost, we can sit down and offer many different ways that they could pay for their procedure or finance it.
Can you tell us a little more about Cambridge Family Dentistry?
Well, sure. We not only offer the mini dental implants as well as other type of implants, we also offer a full-service general dentistry clinic, which treats anything from very small children to the elderly. We have doctors on staff who are all highly trained and can do the implants also, as well as other dental procedures. We have a convenient location at 20th and Webb Road, which is accessible from 96 Highway. We have all the supporting staff like office people, highly trained assistants and hygienists. One big thing we do is we offer emergency services the same day. We have found that there's a lot of clinics that sometimes feel like it's an inconvenience for emergencies. Well, we like emergencies because we know if we take care of a patient that's in need or is in pain or has an embarrassing situation, they're very happy to be able to get that taken care of same day. We also have new technology in the way of maybe a 3D CAT scan, which can show all dimensions of the face, as well as digital x-rays and cosmetic procedures to enhance smile. That's always a big thing that people were pleased with. And we have the ongoing maintenance. So once you have your procedure done, you can always come back and have it checked to make sure that it's going to be okay. And we'll do any necessary adjustments to make sure that everything's working properly. And of course, if we get into an advanced procedure that we feel like we cannot handle and we need extra help, we'll refer you to the very best specialists that we can find.
Wow. That's a lot of great information, Dr. Wright.
Thank you.
Thank you so much. Thanks for being with us today.
Well, it's been my pleasure. Thank you so much.
And we'll be right back.
The huge difference is I don't have to fool with something that bounces up and down that I was constantly conscious of. That if I was out in a restaurant, I couldn't go anywhere and get rid of the food that was stuck under it. I hated the thing. I have from the very beginning, and I had it for many, many years. This is like, well, the biggest impact is my own teeth. They may not be my own, but it's like I grew a second set of teeth.
Well, it all sounds too good to be true, but it's really not. Pick up the phone and call right now and say goodbye to difficult eating, talking with dentures that click, and get back to living life. Please keep in mind that this is a limited time offer. During this program only, we are offering a free consult, but it's only if you call now. It is truly that simple. If you or if one of your family members have experienced any of the things described in this program, then don't wait. Call right now to set up an appointment. If it's not what you expected, then you're not out anything. Thanks again. I'm JW, and we'll see you next time.